Physical. Welcome to the Healthful Woman Podcast, the fastest growing podcast in women's health. Today's Monday, March 21st, 2022. I'm joined today by Alicia Ferriere from Fortify Physical Therapy to talk about physical and pelvic therapy in pregnancy and postpartum. Alicia and her physical therapy practice is really interesting because they spend a lot of time focusing on preventative care, meaning they work with women during pregnancy and after delivery to prevent injuries, as opposed to just treating them when they occur. Call it proactive physical therapy. Cool stuff. All right. Thanks for listening. Have a great day. See you Thursday on High Risk Birth Stories. Welcome to today's episode of Healthful Woman, a podcast designed to explore topics in women's health at all stages of life. I'm your host, Dr. Nathan Fox, an OBGYN and maternal fetal medicine specialist practicing in New York City. At Healthful Woman, I speak with leaders in the field to help you learn more about women's health, pregnancy, and wellness. Welcome, Alicia. How you doing?
Doing good this morning. How are you?
Good. I'm so happy you were able to join me in this early morning to record for the podcast. You're taking the time to talk to our listeners about physical therapy, about pelvic physical therapy, about active women during and after pregnancy. A lot of stuff we're going to cover today.
Yeah, I'm very excited. This is what I do, so I'm excited to talk about it.
Wonderful. So just for our listeners to get a sense of who you are, give us like a brief story, where you're from, how you got into physical therapy and all of that.
Yeah. So I'm originally from New Jersey.
Yay, go New Jersey.
Yeah, I know, not far. Still currently live there, but I work in Manhattan now, so never left the coop too much. But my intro to PT really started when I grew up as a dancer, a ballet dancer, and going along with that comes a lot of injuries. So that was how I was introduced to it. Starting at college, I was actually a biology major because I wasn't exactly sure what type of medicine I wanted to go into. But from there, lots of observation and, finding out what I really wanted to do. I love the aspect of physical therapy of, one, how much I can move as a professional and, keep movement as a big part of my life, but also help people through movement and help people through, really non-invasive means and help them be active and stay active that way. So plus I get to talk to people all day, which is something that I really enjoy.
You're a schmoozer, you're a talker?
Absolutely. Big time schmoozer. Love big people person.
Where'd you do your training for PT, for physical therapy?
Undergrad, I did at University of Delaware. Grad school, I did here in the city at Columbia.
And were you training at the time where getting a physical therapy degree was a doctorate degree or is a doctorate degree?
Yeah.
I don't think people realize how much education and training goes into being a physical therapist nowadays, maybe as compared to before. Can you just let everyone know what you had to do to get to finish? It's pretty crazy.
So the profession has really evolved over the past several years. So it went from a bachelor's to a master's to a doctorate relatively quickly in the span of the time. So for me, I had 4 years of undergrad and then went straight into a accelerated clinical doctorate program that was 3 years, maybe 3.5 really. And that is lots of, it's completely full-time didactic and lots of clinical work. The clinical work varies based on the program, which is actually why I chose Columbia, because they had a lot of clinical work, which I really valued. And then, you come out really with a very broad knowledge. And then from there, you can start to figure out where you want to go. I think the thing with physical therapy is, you can do it in a hospital setting, which is really quite different from the outpatient orthopedics, which is also very different from neuro. So there's many different routes that you can take, and then there's pediatrics. There's many specialties, but you come out of it with a pretty broad knowledge of how to treat a little bit of everything, and then you go from there and specialize as you want.
Right. And so when you finished your initial stage of training, you're already Dr. Alicia Ferriere, right? You're a doctor of physical therapy. And what additional training did you do? Which direction did you go after your time at Columbia?
Yeah, so I had a little bit of pediatrics background, even because I think development is just really interesting. So I did a little bit of that at Columbia, and then from there, I knew I wanted to go into orthopedics. So I started to I have a certification from the Postural Restoration Institute, which is this school of thought that really focuses on biomechanics, natural asymmetry, how your nervous system kind of keeps your postural system in check. Once I came out of school, I started to get really heavy into more orthopedic based clinical training. So there's, I have a few certifications in functional exercise and applied functional movement. I have a certification from this place called the Postural Restoration Institute, which really focuses on alignment and natural body asymmetries. And from there, I started to also really, really get interested in the pregnancy, postpartum, and pelvic floor women's health world, and have continued since taking education from there. I still keep a very, very strong orthopedic education background. Like I literally just took a course a couple weeks ago that was a dissection course just to really kind of further my understanding of not only the pelvic floor, but full anatomy and just really kind of understand a little bit more of how things are working in a system. So, different avenues, very orthopedic based, very women's health focused with the intention of trying to keep myself as holistic as possible.
How did you get interested initially in pregnancy and postpartum space, so to speak?
So I was at my previous job, I was actually at a very running heavy athletics focused clinic, which was super fun, really great patient population. And I found in that space, I had a lot of both pregnant and postpartum patients that really just didn't have a lot of guidance on how to manage their exercise or how to get back into running, or maybe they were having some sort of issue within, like physical issue within the pregnancy that they weren't sure what to do. So I was like, oh, this is a opportunity for me to really educate these women and help them in very easy ways. And so from there, that's where I really started to dive a little bit deeper into the pelvic floor. Since we have in PT school, you're given a little bit of it, and I think it really varies on the program. You're given a little bit of it, but the training is much more on the continuing education post grad end. So I wanted to further my education in that in particular.
It's interesting. We had on last year a physical therapist who specialized in pelvic therapy, but her practice sounds a lot different from yours. Hers was a lot related more to pain, for example, some incontinence as well, but it wasn't focused so much on athletes who were running a lot and having pelvic floor from pregnancy because of that. It was really, really much more, I would say, related to pain. She would see like a lot of young women who had pain with sex, for example. That was a lot of what she was treating, vaginismus and whatnot. But it sounds like you're focused more on the sort of athletic component of the pelvic floor. Is that accurate?
Yeah, I mean, I definitely treat the vaginismus, the pain with sex, all of that. I did find though that there was like sometimes with pelvic floor, there can be a little bit of a gap between treating the pelvic floor and then treating it as a unit and getting that back into function of whatever sport that they want to do. So I definitely try and be all encompassing or give as much as I can to treating the acute issue, whatever that might be, whether it be incontinence or pelvic pain, even pain postpartum, and trying to make sure that they feel comfortable and understand how to get back into whatever type of exercise they want to do.
And how did your practice grow in this? Meaning, was it just something that once you started doing it, everyone came out of the woodwork, or did you have to specifically advertise for it?
No, yeah, it was super organic. It was kind of awesome. Like I started at my previous job, but word just kind of got around, and New York City is full of these little run groups and exercise groups and people who do all this stuff together. So it spread pretty organically. I definitely gave a few presentations on it and, try and put the word out there a little bit, but people really are kind of seeking out this type of information. So I think when it was, presented, it was easily received.
Let's focus now on in pregnancy. What are women coming to see you for? Like what kinds of issues or complaints or pains or problems do they have where they would seek you or, one of your colleagues for physical therapy?
So it can really start from something, basic as like just pain. They have sciatic pain, low back pain, SI joint pain, really like the basics of why people seek PT period is usually because they're in some sort of physical pain. That's a standard one that people tend to seek me out for. Kind of almost feel reassured that it's not just something they have to handle because they're pregnant. It's like, oh, you have back pain. This is what you have to manage for the next 6 months. It's like, no, there are definitely things that you can do to work through that. Beyond that, people can come in if they are trying to remain active in a particular way. So if they're trying to either stay active running and they want some guidance behind that, or, even I've had people who are like, how do I modify my Pilates or my yoga stuff with keeping in mind that they want to keep the pelvic floor healthy. And there's a lot of concern around diastasis and how to prevent for that. And then also too, I have some people coming wanting to really prep for the labor and delivery process, which can really look different depending on the person. But sometimes that can involve perineal tissue stretching and making sure that the pelvic floor they're in tune with the pelvic floor and that they understand how to contract and relax and mobilize it so that the muscle tissue stays healthy for that labor and delivery process. We can also go through how to like generate force downward, which some people have a really easy time with, and some people maybe with not so great mind-body connections have a difficult time with. Ultimately in that process, their body kind of takes over. But I find that a lot of the times if someone goes into that process with confidence of like, okay, I think I know what's going on here, they feel much more in control over the situation.
So it's really interesting. You're talking about almost two different populations of pregnant women. One of them come to see you because there is a problem, right? They're having
Yep.
pain, and either they find you, however, maybe their doctor refers them to you or whatever it might be. And then you sort of, assess them. Where's the pain? Why is the pain? And focus on, exercises and stretches and strengthening and all the things that you do to help alleviate that pain, versus the group that find you sort of as maintenance or as preparation, meaning I'm fine now, but I run 6 miles a day and I want to continue to run while I get more pregnant and, not hurt something or, not
Exactly.
lose, not trip or whatever it might be, or in preparation for labor. What percentage of your practice now of pregnant women, let's say, would be the former, the ones who come because of pain, versus the latter, the ones who are coming sort of to prep for something else?
Honestly, it is much more the latter. Like, I
Wow.
think, yeah, which is awesome. I find that like, I love the proactive approach of like, this is what I want to do and I want to stay healthy. And I find too, a lot of people, there's a lot more of the pelvic floor awareness, especially postpartum. So sometimes I see people just once because they want to kind of form a little bit of a relationship and be like, okay, this is what my baseline is, so that when I come in postpartum, we know what we're kind of working with, and we know that just like a baseline of where they're at. But I would definitely say a lot more, aches and pains come up, don't get me wrong, but I think to seek out my services is much more the preventative or maintenance type patient.
That's so cool. And again, how do they know to even find you, to seek you out? Is it someone like a physician recommends it, or it's usually just, family and friends and running groups and Facebook and those types?
Yeah, it's a little bit. Sometimes, like, I've had some people come from their physicians, but oftentimes it's more like their acupuncturist or their Pilates instructor, or a little bit more of the word of mouth, really.
Wow, that's pretty cool. So let's say someone's coming to you and again, they're athletic. What are sort of the top high level things you go over with them or work with them on or teach them to help them remain athletic during pregnancy?
So it depends on like what their activity is, right? If they're a runner, we're going to look at their run form and just be like, okay, what is going to change? Because ultimately, throughout the course of pregnancy, in any person, their postural system completely changes. Their center of gravity changes. How they compensate for that change is really unique per person. There's the standard typical compensations that you would see, because baby only grows one way, really. It's only in the abdomen, and it's only in one spot. That change in center of gravity is going to maybe affect whatever they want to do. So like I said, if it's running, we're gonna talk through how to maintain control in their run form. Like maybe they need a little bit more knee drive, maybe they need to lead with their pelvis a little bit more versus letting the belly fall forward. Simple cues like that. And again, if they're lifting, we go through lifting mechanics with that change in mind, and how to more so how to like keep them doing what they want with modifications that are going to allow their muscular system and them to like as a person to stay healthy.
Wow. Do you find that for the women who are seeking you out, that their expectations are greater than you think is appropriate or less than you think is appropriate? Meaning, are they coming to you saying, I'm trying to run the Ironman, and you're like, dude, back off, versus they're like, hey, I'm a big runner, can I walk down the block? And you're like, no, you can run. I'm just trying to, because I mean, everyone's, because people are always, asking me these questions, and people are always one direction or the other. It's so fascinating. I'm just curious, what's your experience been?
Yeah, it's a little bit of both. Like I find less so probably the people that are like, oh no, I'm running Boston Marathon while you're doing this. It's like, okay, well, let's talk about how that's going to look. Like it's probably fewer of those people versus like more of a generalized hesitancy towards what
Yeah.
they can do. It's more of like how do I get there safely? And most of the time it's like boosting them, being like, no, you can, if you did this before, you can stay after. There might have to be some modifications to it, and we can talk through what that looks like. But oftentimes it's more of that versus the person who's trying to do all the things while they're still pregnant, or even really, really soon postpartum. Then I have to pump the brakes a little bit.
Yeah, I think that in my experience, there's definitely more women who underestimate their ability to exercise during pregnancy, or
Absolutely.
maybe not just ability, but the sort of like the allowance for it. Meaning, because
Yeah.
there's so much messaging from doctors, from whatever the general public, that pregnant women are very delicate and should not
Hmm.
exercise and should lie in bed
Hmm.
all day and drink green smoothies or whatever it might be, and that's it. And I think that, okay, like there's obviously, like you said, there's some modification that has to take place, and there has to be some, thinking about it. But most pregnant women can exercise. And again, it's really just about not
Absolutely.
getting hurt. It's not so much the cardiovascular, the business with the heart rate's a bunch of hooey balooey. It's really
Right.
just, it's making sure that they can stay fit without injuring themselves. Because as you said, the body changes in pregnancy, both sort of physically in an obvious way, but also the joints change and the laxity of the joints change and people's posture changes. So their back changes, like everything sort of changes. And so I think that some people can just figure it out on their own, and they sort of use their, the cues from, what hurts and what doesn't, and sort of adjust. But I can see why it'd be really helpful to proactively, see a professional and say, hey, I'm thinking of continuing to run. And you talk about, okay, let's talk about your gait. Let's talk about your speed. Let's talk about, what shoes you wear. I mean, there's a lot of things that might have
Yeah.
to change that you don't think about. That's pretty cool. I like that. I like that people find you for this.
Yeah, and it's fun too, because oftentimes if we can, there's particular muscles that get over lengthened in pregnancy, right? Like no matter what, your ab wall is gonna get lengthened. It can't not. Similarly with pelvic floor, it's taking way more of an intra-abdominal load than it has ever. So there's in those in particular, like no matter what, if somebody's seeing me during pregnancy, I'm making sure that they understand how to connect with those muscles. They understand that it's healthy to have them contract and relax and generate blood flow, and that's how we keep muscles healthy. They like movement. So sometimes I find that people are really afraid of using their abs during pregnancy, which again, just messaging in the community. But those abs like to be used, and they have to stay. That's how the recovery postpartum is even easier, is when things don't atrophy and get deconditioned over the period of time. So no matter what, like making sure that they know how to handle those muscles. I find that even if they're not trying to run 5 miles a day or whatever, making sure that they can keep particular muscle groups healthy and balanced, and keep their mind body connection to those muscles, it can be super helpful to maintain stability along the pregnancy, but also have that connection postpartum that's just there.
Yeah, I mean, people always say to me, "Oh, I know that I can't do crunches." I'm like, "Why can't you do crunches?" And I'm always like bewildered by that. They're like, "Well," and they'll sort of like pause, and they'll say, "Well, it's." They think for a while, and they're like, "It's gonna hurt the baby," and I'm like, "No, it's not gonna hurt the baby." I'm like, "Well, how is that gonna hurt the baby?" Like it's it's again, I get it. Like people don't spend a lot of time thinking about this, and they've been told you can't work your abs during pregnancy.
Yeah.
And
Yeah.
I just it's the opposite. You probably should work your abs, because those are the ones that are really getting
Absolutely.
stretched out and getting thinner. And also, there's such an important part of the core And if you don't work your abs, your back might hurt. And so it's all connected.
Exactly.
I mean, these things are connected one to the other somehow. And it's, I know you know how, but it's really, it's important. So people, who are doing things like yoga or Pilates or some sort of core workout, their backs tend to be a lot better when they're pregnant. They don't hurt as much because they're really keeping that area strengthened and healthy, and it's helping keeping their posture upright, as opposed to just the weight of the pregnancy pulling everything forward.
Exactly.
Wow. Cool stuff. So what do you do for women during pregnancy in preparation of the pelvic floor that's going to get altered during delivery, let's say,
right,
for lack of a better word?
Altered. Kind of similar to the abs. It's just another set of muscle groups. And I think sometimes people forget that, that it's because of the location and where it is. Like, obviously it's a huge function of bowel and bladder and sexual function, but also like it controls a lot of intra-abdominal pressure, and that's a lot of force during pregnancy. So from a just exercise perspective, making sure that they understand, okay, this is how it contracts, this is how it relaxes, knowing how that relates to, especially maybe closer to that labor and delivery point, knowing how that relates to labor and delivery. Like, okay, we don't want to contract. We want to make sure we're opening and lengthening during that process. And, I usually have my patients stop doing any sort of contract work for pelvic floor around like 33, 34 weeks, just because there's no need to kind of put more of that load into it. It just needs to make sure that we can lengthen it out. So first and foremost, the awareness, because then again, that mind-body connection postpartum is really, really helpful for healing, depending on, whatever happens in the delivery room. And then beyond that too, part of being a pelvic floor therapist is doing some manual work and having that be, number one, a form of feedback for the patient, because in that case, they could be a little bit disconnected. So, if they're contracting, I can give them feedback of like, okay, this needs to be a little stronger, or we need to work through the relaxation a little bit. It really depends on the patient. And then from there, we can do, like I said, some of that manual therapy for the perineal tissue to make sure that, just like any other skin muscle tissue, it's hydrated and it feels like it has give, so that during potentially like a vaginal delivery, there's a little bit more blood flow, a little bit more stretch to go around to, hopefully, the goal is to prevent severe tear. And grade 1, grade 2, really depend on the baby and the person. But the more severe tears that require more recovery postpartum are what the goal of trying to generate blood flow, generate more muscle awareness and pliability in that area really, really go for.
And when you say feedback, do you mean with like an exam and you're saying, left, right, more or less, or is it with sort of like a manometer, some sort of like pressure probe that you use?
It's usually with like a manual exam, like my finger, but there are plenty of things on the market that you can use, that you can play a game on your phone and be like, oh, this is what's happening. And it's, that biofeedback loop.
Right. And so in terms of women who come to you postpartum, I'm going to ask you the same sort of percentages that I asked you before. How many are coming to you because I'm postpartum, I'm in pain, I'm having a hard time recovering, I'm having incontinence, versus sort of maintenance? Like, I had my baby, let's sort of, what do I need to do to get, back in my Pilates class, or, back doing my, CrossFit or running or whatever it is?
So I would say that goes more maybe 50-50. Like I find that it depends on what's going on at home. Do they have support? Can they get out? Like, how are they handling new motherhood and whatnot? I do find that probably more often they're coming because they're having some sort of incontinence or pain with sex, or most of the time they are coming to me for that. I think it's becoming more and more common for women to seek me out just to be like, okay, I know I want to run in 8 weeks. Like, how do I do that safely? Or, you know what I mean? Like,
yeah,
having that goal. But I do find that there's usually some sort of pain associated with it. And then you have some people who are just like, oh, I know that I tore a little bit. Can we like make sure my scar is mobile, and because I want to have another child, or make sure my pelvic floor is okay. But definitely a little bit more balanced on that postpartum end.
Yeah, I think that makes sense, because I think most women, if not all, are going to have some sort of pain after delivery. Yeah. And there's a very high percentage that are going to have some sort of incontinence. I mean, fortunately, with time, a lot of it gets better, but not all of it. And it may not come as quickly as you'd like. So when you're seeing her? Is it normally within a couple weeks after delivery or normally, after 4 8 weeks?
I kind of get it's a pretty wide variety. I usually tell, especially when I'm able to see them in pregnancy and I know that they have a grasp on like, okay, you can start, finding those abs as soon as you feel comfortable, finding your pelvic floor and just like engaging those muscles. If I know that they have that, I'm like, give yourself 4 to 6 weeks just to heal and just to adapt to the fact that you now have an infant. So most of the time, I'm not seeing people immediately postpartum.
Hmm.
Just from a healing perspective, they need some time just to heal in general. But it does tend to lead into a little farther down the line when they want to get back into more intense exercise, and these things are coming up, and it's uncomfortable, or either they're like pain, incontinence, or they want to make sure that they're doing it safely to not hurt themselves down the road.
Putting aside the women who want to get into more heavy exercise, so let's just talk about sort of, quote unquote, typical births, women, whatnot. What would be your advice to women as to, okay, everyone's going to have some sort of symptoms after birth, right? Everyone's going to have some pain, maybe a little bit of incontinence here, there. At what point do you think they should start seeking you out or someone like you? Meaning, at what point you say, all right, this is not normal, so to speak, or this is something we treat? Is it like everybody with any symptom, or is it after X amount of time or a certain amount of like severity? How would you advise women? And I obviously we're totally cool with you saying they should see you right away, but so what would you think is sort of
I'm a little biased.
yeah, and it's just fine. Okay, listen, I mean, you work with them and you see the results, and that's great. But let's say not everyone can go to physical therapists after birth. Like, what would you say is a good benchmark for women to know? All right, if this is happening, you probably should seek someone out.
If there's no like like if people heal really well, and if that feels completely fine. I mean, there are in other countries like immediately post birth they get a script and they go to pelvic floor PT at least for an evaluation to see like, okay, what's happening here, how can we help these muscles along. But I would say like after that 4 to 6 week mark, like if everything is cleared by your OBGYN and you're still having discomfort, like if they say you can go back to exercise but you don't feel comfortable, there's plenty of people that can help you get there. Or if you're having pain, like if there's a significant amount of pain and it doesn't sit right, whether that be C-section scar, or in the perineum, if the vaginal tissue doesn't feel great for any reason, even a little bit of guidance, whether it be one visit or a few, can be really, really helpful.
What about with incontinence?
So incontinence, I usually say like in the first couple, first couple weeks, the pelvic floor is just like coming to, everything is coming back to its normal space and all of that. I kind of go on the same realm. Like if they're still having incontinence and they've been cleared by their doctor for exercise, that can be taken care of.
Yeah, I think that makes a lot of sense. I think it's probably unnecessary in a routine situation to seek anyone out within the first 4 weeks. And
Yeah.
probably after
Yeah.
6 weeks, if you're still having pain or incontinence, again, it may go away on its own, but that's probably a reasonable time to seek someone out. 4 to 6 weeks is sort of that gray zone. And also, usually people don't see their doctors at 4 weeks postpartum. It's usually 6. Why that is, whatever. It's sort of random. But, okay. So I'd say I think earlier than 4 is probably a little early. And after 6 is probably really an appropriate time for women to seek you out. And what kind of things would you do with them to make it better? Again, with incontinence or with pain after birth?
So definitely have a pelvic exam of seeing is the pelvic floor functioning how we wanted to. Sometimes whatever the mode of delivery, either like I find often sometimes with C-section, the pelvic floor actually compensatorily gets really tight because the abdominal wall has been cut into and there needs to be a form of stability. So incontinence can be from a variety. It's not always just weakness. That can cause it. Sometimes it's the pelvic floor is too tight. There's no give. So when you cough or sneeze, there's no room for anything to move. So really kind of finding out why, like figuring out what's happening as to what's causing the incontinence, and then working on whatever that might be. So if it's too tight, we'd be like, okay, how can we make sure that the ab wall is a little bit stronger, that we're working through lengthening the pelvic floor, making sure that we're managing those pressures in the abdomen a little bit better. And if it's weakness, okay, is the scar moving? Like if there is a perineal scar or anything, like is the tissue healthy and moving so that it can accept load and accept work in the right way?
And what about the other group of women, the ones who aren't, let's say, having symptoms? but the ones who sort of saw you during pregnancy, prophylactically, and now the same concept after birth, and they're like, listen, I'm a runner. I want to get back into running, and I'm going to come see you. What do you do with them?
So making sure that they're kind of starting out, strength is number one goal. Even if your goal is running, if your goal is really anything, because your body just went through an enormous muscular transformation, making sure that their body feels stable is 100% my first step. So key target muscles, like in general, are going to be your abs, your pelvic floor, making sure your hamstrings and your glutes everything's keeping everything really solid. And then from there, starting to, we'll use the example of a runner, starting to load the system in, whether that be single leg, and then starting to work towards a little bit more plyometric. So jumping, making sure that the system can tolerate it. Because if they, depending if they have to run in pregnancy because it didn't feel good, okay, we have to recondition the system to adapt to those forces. And if for the pelvic floor, I know people are very, that's a hesitancy with running and the pelvic floor, is that they're going to have prolapse or they're going to have leakage or whatnot. So really just kind of slowly but surely giving them a program that is challenging and loading the pelvic floor through jumping, plyometrics, or weight, and then transferring that into more running specific type things. So doing some drills, making sure that everything feels good with that, and then getting back into a running program. I'm a huge fan of intervals for both pregnancy and postpartum in general. Like, it's just such a better way to work the system. So often you hear people, they're like, oh, I'm just going to go do a really slow mile. It's like, okay, well, what does that do? It when you go slower than you're normally used to, your cadence slows down, your ground contact time increases. So the true actual gravitational load on your body is pretty high compared to if you're like, all right, I'm going to do a minute on and 30 seconds off. When you're running, and it feels there's control in that. And then if you're walking, and the gravitational load doesn't really change very much. So I'm all about intervals for not only trying to run during pregnancy if it feels uncomfortable, but also getting back into it. Plus, it's a great way to just cardiovascularly kind of train your system.
Oh, that's so interesting. Now, wow, that is really interesting. I never thought about it that way with the gravitational load and all that when you're running slowly, that you're hitting the ground a lot more in that sense.
That could be a reason that people have incontinence with running postpartum, is that they're running slower than they're used to, and there's just so much more pounding on the body that,
right, when
you're normally running, the entire muscular system is trying to be explosive in a sense, right? Everything is trying to get you to progress forward and up. But when you're spending more time on the ground, there's just so much more time, especially on a relatively lax system, right? The all of the joints are a little bit more lax too, so the muscular system has to compensate even more than it's used to. So if it can't handle that load, that's when things can start to go awry.
Wow. And so when people are coming to you for this, again, we're talking about sort of the group without specific complaints. They're coming to just sort of get back into exercise. And you talk about a program. Is that something where they need to see you once or twice a week, or is you sort of see them and check back with them in 3 weeks, give them sort of an exercise regimen? How does that work? Or is it, I assume it's tailored for every person, but what's typical?
Yeah, it's definitely tailored for every person, but I'm usually not wanting to see them 2 times in a week, just because if they're not coming to me for pain, if there's nothing acute that we have to work on that requires hands-on skill, and it's more of just okay, let's see how you're adapting, you need time to be able to do that. So that might look like once a week for the first couple weeks to really keep an eye on things, and then have it space out. It could be every 2 weeks. Generally, if there's no acute pains that we have to work through that I'm really wanting to keep my eye on, it's much more spaced out, because you need to have the time to do the work and see how it feels. And oftentimes, with new moms, it's finagling the schedule is also difficult as well. So I try and give them as much time so that there's not pressure to be oh, I have PT next week, I have to make sure I do my stuff. There needs to be that variability and adaptability.
I find that a lot of postpartum women also underestimate their ability to get active again. And frequently this is because they're told you're not allowed to do anything until 6 weeks, which I think is incorrect. I mean, obviously, if you have a C-section, it's a little bit different because just pain's going to limit you. I mean,
right.
It's not that it's dangerous to the body. It's not like your incision's going to open up if you're active. It's just going to hurt. And so it's not really, it's not going to be enjoyable, and it's going to limit you, and you're going to be, using other muscles to sort of compensate. It's going to be unpleasant. But for someone at a vaginal delivery, I usually tell them whenever you're up to it, like it's fine with me. I say start slowly because obviously you want to, not, injure yourself. And my general rule of thumb is, and this is true for women with the C-section too, is if you're doing something and it does not hurt you, it's probably okay. But if you start, pushing yourself to the point that you have pain, then probably you need to back off. And this is again during the first, 4 6 weeks. Very few people are doing any exercise in the first 2 weeks, 3 weeks. Some people feel great after 2 or 3 weeks and are ready to start. I would say most people are probably ready by 4 weeks, and they're usually holding back because someone's told them they have to hold back.
Exactly. And I find that too. It's like, well, if you, what's your definition of exercise? You're squatting down to pick up the baby multiple times a day. You're doing all these things like, that's work, that's load. And if you feel good, that's your body's way of being like, okay, maybe let's like go for a longer walk or whatever it might be. Like I think that 6 week mark is it's just a number, right? So
Yeah.
it depends on how your delivery was. And some people still need a little bit more recovery. It really depends on the person. So
yeah. Birth can be rough on a lot of people. There's no question about it. It could really beat someone up. And there's definitely people who need well more than 6 weeks to recover physically from their birth. And I do think it's really more about, it sounds, kooky, but the listen to your body stuff. It's true. Like it's real, people, you get feedback from your body, if you're doing something and your body doesn't like it, it'll tell you, right? Very
Absolutely.
quickly.
I tell you all the time, I'm like, your body better than anyone else. And it's going to tell you. The hard part is making sure that people listen to it,
Right.
Which depending, like, I with those people who are like, oh, I'm going to run like this triathlon during pregnancy, they have a history likely of like shutting down some of those signals. So in those cases, you got to rein it in. But oftentimes your body will tell you what's up. You just got to listen.
So Alicia, all of our listeners are obviously now, totally obsessed and infatuated with you. How could they find you?
My business is called Fortify Physical Therapy. That website is just fortifypt.com. All my contact info is there. I'm located in Chelsea in Manhattan over on 26th Street. I am on Instagram as well, Fortify_PT. I know, trying to up my Instagram game, trying to do my best.
And what was it? Sorry, I interrupted your whatever it's called, your tag, your hashtag, your address, whatever you call it on Instagram.
Oh yeah, Fortify_PT.
Beautiful. Alicia, thank you so much for coming on the podcast. This is really
thank you.
Enlightening to me. And I really love the idea of preventative care for women who are pregnant or postpartum. Again, if you have the time, if you have the means, if you have the wherewithal to sort of get ahead of a lot of this, I think it can be really beneficial. And for those who can't or don't or won't, obviously if things start hurting or you're having, symptoms, it's important to be on them pretty quickly because they're usually treatable if you focus on it and see the right people. So I'm really happy that you exist for all my patients. That's for sure. And also for our listeners, many whom either they can see you personally or someone like you around the country, around the world, wherever they are.
Yeah, absolutely.
Wonderful. Well, thanks for coming on the podcast. We will see you around.
Thank you so much.
Thank you for listening to the Healthful Woman podcast. To learn more about our podcast, please visit our website at www.healthfulwoman.com. That's HEALTHFULWOMAN.com. If you have any questions about this podcast or any other topic you would like us to address, please feel free to email us at hw@healthfulwoman.com. Have a great day. The information discussed in Healthful Woman is intended for educational uses only and does not replace medical care from your physician. Healthful Woman is meant to expand your knowledge of women's health and does not replace ongoing care from your regular physician or gynecologist. We encourage you to speak with your doctor about specific diagnoses and treatment options for an effective treatment plan. Paid sponsors of the podcast are not involved in the creation of the podcast or any of the content. Support for our sponsors should not be interpreted as medical advice from the podcast, the host, or the guests.